Surgery short case, trigger finger. One of the ultra short surgical case. Your examiner will ask, please examine this patient hand. Then you should look, are there any obvious abnormalities? Can you see any obvious abnormalities here? No, there is no obvious abnormality. Then you should ask your patient to flex the finger. After that, you should ask, can you suddenly extend your fingers? Yes, patient can extend fingers suddenly except trigger finger. After few seconds of attempting, patient can suddenly extend trigger finger, or sometimes he has to do it manually. Now your diagnosis is trigger finger. Then you have to palpate palm aspect, especially metacarpal head of that trigger finger. There can be small tender nodule. Now your diagnosis is confirmed. Diagnosis is trigger finger or stenosing tenosynovitis. That is the proper name. Now you are going to present. This patient is having difficulty in the extending of middle finger of right hand. After flexion and extending, there is a sudden extension of right middle finger. There is a small tender nodule over the third metacarpal head of right hand. So my diagnosis is stenosing tenosynovitis. That is how you are going to present. Then your examiner asks few questions from you. What is the pathophysiology? What is the pathophysiology? Your tendon sheath like this. Your tendon run through the tendon sheath. What happened here? At the top of the metacarpal head, tendon sheath fibrous and thickened, so it is so narrowed. Usually on the top of the metacarpal head, tendon sheath fibrous and narrow. Because of that, this tendon can't freely move. That is why triggering happened. That is the pathophysiology. Next one, what are the causes? It can be congenital, or it can be following trauma. Or it can be idiopathic. No cause found. Next one, what are the treatment options? You can do the physiotherapy. Heat fomentation, physiotherapy heat fomentation, short course of analgesia. Why sometimes here can be tender, short course of analgesia, but definitive treatment is surgery. How are you going to do the surgery? Surgery has to do in the bloodless field. You have to divide this tendon sheath longitudinally. You have to cut this tendon sheath longitudinally and you have to release the obstruction. What is the proper name? Now you know, stenosing tenosynovitis. Thank you very much.